Before a medical birth, an OB/GYN will prepare for extreme intervention methods as standard operating procedure. When the birth process is deemed delayed, a muscle-contracting drug is administered in an attempt to push the baby through the frequently subluxated and unyielding pelvis.
As you might imagine, forcing nature is seldom without repercussion.
The expecting mother will be required to essentially sign her and her child's life away should she allow the doctors to perform their standard procedures. Various methods of extreme infant extraction are commonly used today. Though they may be barbaric and difficult to imagine, they are still used routinely in our hospitals.
Why don't babies born in cars need to be pulled out like this?
Well, the less we mess with nature, the easier things are.
Even without complications, C-sections are on the rise. Are we becoming less able to bear children? Or is it more profitable and convenient to schedule delivery?
Isn't it easier on the baby to be born cesarean style?
How easy does this look?
Complications are much more common with unnatural deliveries. They may even immediately life flight the baby away from the mother for emergency medical attention. This can be an emotional and costly ordeal for the parents. With all of this medical high drama, it's not hard to believe that it is safer for a mother to give birth in 20 other countries than it is for her to give birth in a hospital in the United States of America.
That's difficult to imagine. I can't even name 20 other countries.
For 2 weeks, this baby will be isolated in an incubator, while some will live on respirators, and some will even be given nitrous oxide intravenously as treatment.
Between 35 and 90% of the drugs prescribed to hospitalized children are either not licensed for children's use or are prescribed outside the terms of their product license, according to a British Medical Journal report in June of 2002.
The parents of the baby will endure sleepless nights worrying about the health of their child. In addition, not being able to breastfeed is proven to adversely affect your child for a lifetime, with weakened immune systems, increased chance of diabetes, obesity, ear infections, allergies, osteoporosis, and even cancers. Statistics prove that an expecting mother under chiropractic care will experience much less time in labor than mothers without chiropractic care. Women who give birth at home enjoy a warm environment with a certified nurse midwife as a safer and more natural alternative. A funded study found that babies delivered by certified nurse midwives are 19% less likely to die at birth than those delivered by OB/GYNs, and 33% more likely to survive through the first month. Now compare the malpractice premiums of OB/GYNs, medical doctors, certified nurse midwives, and chiropractors. You will notice that the medical premium is 12 times that of the midwife and 200 times more than a chiropractor. Do insurance companies take a huge risk on midwives and chiropractors, or do they know something that we're not being told? This time, when a newborn shows similar complications, having a doctor of chiropractic available to immediately address the cause can be priceless. The result is a healthy baby that is full of life. A common misconception that often prevents people from receiving such valuable care is that cracking your spine is dangerous. Chiropractic care is safe, gentle, and effective. With some, not all, chiropractic adjustments, a joint release sound may be heard. This is only the healthy restoration of normal joint mobility. With regular chiropractic maintenance, there is much less colic, spitting up, gastric reflux, and ear infections in the first years of life. Full genetic potential is expressed daily with the full ability to learn and grow throughout childhood. As for chiropractic safety, you may have never seen a child cared for more gently than in the hands of a family pediatric chiropractor. The baby experiencing chiropractic care will also allow the parents to sleep well. The whole family will wake up bright and refreshed. Lack of sleep has disastrous effects on our moods and relationships, our health, and our productivity.